My delightful duty now is to introduce our next speaker. And I'm really pleased that we're going to get an international perspective now on population health. And I'm going to introduce Dr. Rafael Bengoa, who's the co-director of the Institute for Health and Health Strategy in Spain. He's a former health minister in the Basque region and has also done work in Northern Ireland and globally. So, Rafa, would you like to come and join us?
Thank you, Paul. Good morning, all. Thank you for changing jobs, Mike. International perspective. Actually, the international perspective is learning from you, and I'll show you why England, Scotland, and the Nordic countries are probably the ones that are going to hit this off first. This is the Toluca Bridge. It is a bridge that has been constructed by the Americans and the Japanese in Honduras, where floods took all the bridges away. So they asked this consortium to build this bridge, an indestructible bridge. They did so, and you can see nature went elsewhere. That nature is dementia, that nature is mental health, that nature is chronic diseases, etc., and that's what we're talking about here. The important thing is that we're still, for some reason, constructing the bridge, and we haven't really pulled off, in most countries, in most European countries, the type of course, infrastructure and care system that we need for the change in nature. This is what you get. This is what you get in most European systems. You get a very fragmented system. You all know that we've been really good at building silos. If we had actually planned to build silos, this is what we would get. And now we have to obviously try to get away from that. So I'll be talking a bit more about the policy perspective and the organizational perspective that is coming through in order to get to have people like Mike work in the optimal conditions on the ground. The Australians call this lethal discrimination, in the sense that that fragmentation in mental health creates this situation in which we do more or less okay when we're treating mental health people, but actually most of them are dying not because of the mental health issue, because we're not doing what we should be doing in treating the head and the body together, and most of them die 15 years younger than most of us. The idea being that we have fragmented their care, and there's a sort of discrimination just because of a concept that we have in mind of how to deal with this issue. I think we all know the challenges in healthcare, and just remember the bridge have moved very fast, but the shape it takes is, of course, a really rapid advance in technology and medical science, a complete information overload that we don't really know how to manage. We're trying to dissolve the traditional barriers of all those silos. We're trying to interconnect systems that are disconnected. There's an increase in all those multimorbidities that Paul was talking about. And the majority of those in Europe eligible to manage healthcare organizations are not really equipped to cope with this complexity. So we stay on a short wavelength all the time. The response actually is quite interesting. We're tracking, together with David Hunter from Newcastle University, we're tracking what this response looks like right across Europe. And Paul mentioned the long-term plan. That's the one you're going to be obviously living in. The French are going to be living in one which is related to something that we would never have expected from the French, which is a decentralization this summer. And they're actually going to develop some sort of place-based organizations locally. That's the intention. That was launched this summer. And most European countries, you can see the Swedes there, etc. Everybody is moving, and we're trying to obviously move in that direction in Spain as well. The important thing with that is that it looks like we're all moving into the same direction. That direction is saying, I'm going to be much more preventive, proactive, better chronic condition management, a greater focus on quality, give much more voice and empowerment to patients, population health management. Within all that, continue tackling inequalities and expanded use of information and communication technology. I think that's all those documents contain that direction of movement. So I think we're going to be able to learn from each other in quite an important way. The last move, of course, is that 1 in 8 of those 12 documents, policy documents, organizational documents, can identify the triple aim, the quadruple aim, as the framework of work to ensure that we address population health and not just the medical world and not just efficiency, and that we're just not obsessed just with target performance logic, but we try and humanize what we're trying to do. And the triple aim, which is present in the US at, let's say, at local accountable care organizations that many of you know about, not at the completely policy level yet, although Obamacare was on that move. Trump definitely is not. But the important thing is that in Europe, we have 8 documents basically saying that's the direction I'm going to take. To make it easy, what most people are trying to pull off, of course, is much more at home, much more in the community, much more prevention, much more primary care, and less in hospitals. That we know politically is very tough to pull off, but I think we're beginning to get there. And I think having lived here a long time, having been in just about everywhere in Europe, I think where this is going to happen first is Scotland, England, and Nordic countries, and we're hopefully going to also move in that direction in Spain. I think the insurance-based systems in the center of Europe are going to have a tougher time to go in that direction for many reasons that we can discuss. What does it mean? Well, it means we have to start, of course, integrating with that bridge what we actually need in population terms. We have to bring those two worlds more and more together. And this is beginning to take organizational shape on the ground. I think we now have 7 or 8 countries in Europe where we have something like newly integrated local care organizations. You call them ICSs here, STPs, etc., which are building in that direction, the Vanguard movement. But I think we can now say that there are 7 or 8 countries that are clearly moving towards managing some sort of local health system, precisely because they're trying to get away from the bridge and they're trying to bring it closer to what we need. That means we're doing the hardest change in the last 40 years in health systems. We're moving from a non-system, this fragmented piece where you have we're managing individual organizations and we're planning year to year, to a system in which we're place-based and we have to think about needs and we have to think about midterm planning with a very important focus on data and information, as was just mentioned. That is a very radical move in healthcare. The fact that one needs things like the 10-year plan and a policy expression to take in that direction, and a lot of support for organizations who are trying to pull it off, is key at the policy level in these European countries. Why do I say that I think it's going to happen here and in the countries I mentioned before than in other places, because I think there's much more policy implication in the UK and in the Nordic countries, and hopefully in Spain, than in other countries. And I think we're all moving in this direction in a fairly aligned way. In other sectors, just to connect it a bit with technology, it seems that in other sectors, technology has clearly pulled off more for less. So that would be just one part of the triple aim. But why isn't it actually going faster in healthcare? Why not in healthcare? Why can't we see the same speed of movement as in other sectors? Well, many people in the tech world say, well, it's because healthcare is not as disruptive as other sectors. So what can we do? What are the other countries doing to accelerate this change? What else does one have to do apart from the alignment that I mentioned before to move forward? Well, you really can't get more disruptive than this. So I don't think it is about the expression of disruption and the intentionality of making sure that we're on a population health agenda. To move from the fragmented system to a system of place-based system obviously is the toughest thing. It's extremely disruptive, and you need tons of support in order to pull it off. And of course, technology is going to have to play a very big role in that. So together with David Hunter in Newcastle, we're tracking for WHO what is actually happening in these countries, not only in the what, but in the how. How are they pulling it off? So I just want to mention 2 or 3 things this morning to you on that. We know the toughest part is implementation. The toughest part is not design. The toughest part is not to design the 10-year plan in here or in Spain or wherever. The toughest part is actually to pull it off. So you probably have to think about moving many other things along with technology. And you know more than technology than I do. I just think that we heard from Mike and from Paul that one has to create an environment which is much more complex in order to move this agenda forward. So the first thing that we're trying to find out from all these countries is whether people are really aware of how hard it is to implement. And I won't go through this long list because of time, but basically there are many, many reasons why there's going to be implementation failure. And that's why we have to make sure that there's enough strength, there's enough partnerships, as Paul was mentioning, in order to pull this through. Because there's a lot of reasons for resistance in healthcare for this change. For those of you who are interested, these things are collected in these 2 documents, 2 meetings, one we had in Durham and one we had in Madrid. And they're on the WHO site. But basically, what we're driving to is what are the factors that one needs in order to make sure that at the policy and organizational level, we can pull off this very complex change. And we're using an English framework from Pettigrew from 1992, which basically says you have to move a battery of levers. I won't go through them again, but basically it's the soft territory, if you wish, in many senses. And I just want to connect some of those a bit to technology as we move forward. So there these 5 factors are make sure you're managing politics. The people who think that politics is going to disappear from healthcare are probably going to be deceived, because politicians, and I've been one, love healthcare, and to get even into micromanage healthcare. So they're going to be there. And one has to learn how to manage the politics of this change. The actual coherence of policy, you have some countries in Europe where you have different policies coming down from the top, and they're not aligned. They're actually incongruent with what has to happen in the ground. That's happening just about everywhere, and it's because the people at the top maybe don't have a complete understanding of what they want to pull off on the ground. And the important thing is that all the policies, therefore, have to be aligned. Do you have the key people leading change? In most European countries, we don't have system leaders. We don't have enough system leaders. So how can we get to population health, or how can we get to those more complex organizations, accountable care organizations or ICSs, if we don't have enough of those? So how does one create them, and how does one push that agenda forward? Do we have a supportive organizational culture to do this? You can see it's soft territory, but actually it's what is going to make your technologies fit in a much more successful way if they are, let's say, managed in this type of setting. And of course, the managerial and the workforce relations that have to be pulled off in these. So either we engage the health professionals or we're not going to see this change. Now, the ingredients for success, just to quickly finish off, is the things that we're picking up from what's happening in Sweden, Denmark, here in England, and other countries. So you have to obviously be creating a strategic alignment. If there's no vision, you do have a vision here. In Spain, there's no vision. In France, there's beginning to be a vision. In some countries, there's no vision, so you can't really expect alignment. And if you can't expect alignment, don't expect change. You can be saying that we have a big problem with chronic diseases and demography, but if you don't put a policy statement like you have here, or like the Scots have, et cetera, in Ireland, you're not going to be able to move forward. We're also seeing a general change agenda, which is much more bottom-up and much less top-down. Top-down hasn't worked, so we're all trying much more bottom-up type of change. That means letting go. It means letting local organizations freer to do things like Greater Manchester here or other ICSs. The critical role of relationship building in those levels. Everybody, when you say, well, okay, what actually produced the change in that area? What actually, why did it happen? Everybody says leadership. Yeah, but what does that mean? And it means, well, formal and informal relationships with the people at the local level seems to be what's pulling it off. It's not going to happen through some sort of strict legislative agenda. Although, of course, you have to change legislation so that can actually take shape. It means to being from the top level, being giving much more important about the ends and being much looser about the means. Let the locals do the means. You just say what you expect. It means, of course, putting systems before structures. That's why we called that in the Irish, in Northern Ireland, we called the document systems, not structures, precisely because of that. Plans will have, of course, as you move forward, very unintended consequences. And therefore, you have to be very flexible in terms both at the political, organizational, and delivery level. And so we're beginning to see, even in countries like Russia, that course correction is okay. Incrementalism is okay. You're not going to see in 10 years' time what the 10-year plan is saying. You're going to see something else. So continuous course correction and fed from the bottom is going to be very important. And why is this an opportunity? Why is all these changes, and why am I mentioning them? Why are they an opportunity for technology? Well, first of all, the move towards the river, the move towards local systems of care is inevitable. Because I think we all know that our NHS type of systems, or even the insurance systems, are unsustainable. And they have a lot of adverse events, a lot of quality issues, and we know that we have to do something very different. Or are we going to continue building the indestructible bridge? It has to be, people are beginning to see it as a, and we heard Mike, it's a people business, it's human. It's not about structures, buildings, solutions. This human factor that is present here is key also in the way we move forward on this agenda. The more technological organizations can help in implementing that move that we mentioned, the move towards different types of leadership, new organizations, etc., the more welcome you will be with your technologies. What does that mean? It means don't lose too much time going where that isn't happening. And with whatever technology you have, go where they're actually doing this seriously, where you start seeing that the elements, that somebody is putting the elements in place to get beyond the bridge and to have a real integrated care system on population health. And there are more, let me talk about the whole UK, there are more in the UK than anywhere else. So where is technology going to fit faster than everywhere else? Well, in the UK and Nordic countries. I think moving that way, little by little, and evaluating it will show the benefits of technology, which you know to show. You'll be able to show the economic benefits, of course. But what I'm trying to communicate this morning is also you have to show the implementation benefits. How can I help you implement this really sophisticated change you have? And if you can help me implement that with whatever solutions you have, then you are going to be welcome in my organization. And that, of course, will change the idea little by little that technology is an investment and not a cost, which is something we still have to get over. Okay? So thank you very much.